All right. Hello, everybody. Today is Health Awareness Theme National Winter Sports Traumatic Brain Injury Awareness Month. So, what we are doing here at the Green Nurse is we're going to be looking at different health awareness themes throughout the year. And we're going to educate on how the endocannabinoid system plays a significant role in all of those health awareness themes. So today's theme has to do with traumatic brain injury. National Sports Traumatic Brain Injury Awareness Month is January. So when we're talking about national winter sports, there's a ton of them. Skiing, snowboarding, sledding, ice skating, hockey, snowmobiling, or just general exercise out in the cold. The interesting thing is that 5.3 billion people live with traumatic brain injury disabilities. That's a lot. Over 52,000 people die of a traumatic brain injury every year. And basically, the thing that was so compelling to me, reason why I'm sharing this, is because research has shown that people that have THC in their system at the time of injury are less likely to die than those who do not. So THC can be a protective mechanism. Very interesting. So what is a traumatic brain injury? So a traumatic brain injury is a brain dysfunction that's caused by an outside force, usually a violent blow to the head, a result of a severe supports injury, a car accident, or just a regular accident. One of the nurses that we shared her story, she was a pediatric nurse, and basically she was headbutted while she was working. And that was her third traumatic brain injury. And she had a severe case of traumatic brain injury, and she is disabled, but cannabis has saved her life. So there's 3 levels of traumatic brain injury: mild, moderate, and severe. A concussion has been known to be a mild traumatic brain injury. So symptoms of a traumatic brain injury can happen immediately, days or weeks following the injury. So mild traumatic brain injury symptoms are as follows: loss of consciousness, being dazed or confused, dizziness, balance difficulties, weakness or numbness in the arms and legs, headaches, nausea and vomiting, drowsiness or increase in sleep, sleep disruptions, restlessness, blurred vision, ringing in the ears, changes of smell, memory problems, difficulty concentrating, changes in mood, anxiety, and depression. So that can be pretty traumatic for someone. And then just imagine if it gets worse, right? So if it gets worse. So there's a reason why it can get worse. So moderate to severe traumatic brain injuries are all of the symptoms above. However, they can be prolonged or worsened. So prolonged loss of consciousness from minutes to hours, persistent worsening headache, worsening nausea and vomiting. Some people with traumatic brain injuries have seizures. They get that pupil dilatation, big giant pupils in one or both eyes. Some people get clear fluid coming from their nose or their ears, difficulty waking up, weakness in their toes and fingers, numbness of their toes and fingers, coordination problems, extreme confusion, agitation, combativeness, slurring of speech, and coma. So with moderate to severe traumatic brain injuries, we've seen people hospitalized. The treatment generally is rest, medication to decrease symptoms, surgery, and cannabinoids. So what happens with a traumatic brain injury? So what happens post-traumatic brain injury, meaning after the injury? You just think about it. Your brain has taken this big, huge, giant blow. Our brains are floating around in our skull, right? And so you think about, if you don't have the adequate padding, if you bruised brain, right, what's going to happen over time is the body can release these toxic chemicals that can cause further damage to the brain. And that's called exotoxicity, oxidative stress, and inflammation. So these processes can cause a neural death or brain cell death even after a person is stabilized, and can cause more damage than the original injury. Really, really important. So cannabis as a treatment. Cannabis can minimize secondary brain damage that happens after the original injury. The endocannabinoid system has receptors throughout the body and the brain. Cannabis can interact with the receptors that may help the body from releasing those pro-inflammatory cytokines that actually cause the inflammation. Cannabis is a neuroprotectant, very, very amazing at protecting our brains. So what about the benefits of using cannabis for symptom management? So if you have a traumatic brain injury, we always want you to follow doctor's orders. However, cannabinoids can help mitigate side effects and help to improve quality of life. So when you understand the endocannabinoid system, and we talk about our little handy dandy umbrella there, the endocannabinoid system is the largest neuroregulatory system in our body. It regulates all 11 organ systems, our immune system, and the neurotransmitter signaling systems that tell our bodies to either do something or stop doing something. So and this is the reason why it works on so many different things at the same time. The umbrella concept, because people don't understand the endocannabinoid system. So I always go back to my handy dandy umbrella. So just imagine the umbrella is your body. All of the different spokes of the umbrella are your different organ systems. Your central nervous system, your brain, which is in there, cardiovascular, respiratory, gastrointestinal, reproductive, muscular system, skeletal system. I already said reproductive system, immune system, integumentary system. So we have neuroendocrine systems. So we have all of these different organ systems in our body that are the spokes of that umbrella. The different fabric pieces of the umbrella that attach to the spokes of the umbrella, I like to call them the neurotransmitter signaling systems. So the fabric pieces of the umbrella give messages to the spokes of the umbrella to either do something or not do something. So just to review, the umbrella is us. The spokes of the umbrella are our different organ systems, body systems. It shows the interconnectedness. The fabric of the umbrella that connects to the spokes of the umbrella are the neurotransmitter system signaling systems that give the messages. And when you go to the very tippy top of the umbrella is the endocannabinoid system. It blankets on top of our entire umbrella because we have cannabinoid receptors on all of the spokes of our umbrella, and we have cannabinoid receptors on the different fabric pieces of the umbrella. So the endocannabinoid system, we make components in our body very similar to the plant, and that's why it works. We make components very similar to the plant upon demand, depending upon what's going on in our umbrella. Those components that we make, internal endogenous cannabinoids, mimic the plant, and they give messages to the different fabric pieces of the umbrella and give messages to the spokes of the umbrella for homeostasis and balance. So you can see why having a healthy endocannabinoid system is going to keep our umbrella healthy. If we do not make enough of our own internal endogenous cannabinoids, what happens? We don't get rained on, and we don't get rained on, messages don't get where they need to go. The on-off switch of our endocannabinoid system gets confused. So let's get back to cannabis as a treatment for traumatic brain injury. So cannabis can minimize secondary brain damage that happens after the original injury. So like I said, the endocannabinoid system has receptors through the brain and the body. Cannabis can interact with these receptors, which may help the body from releasing those cytokines that actually cause the inflammation. So what about the benefits of using cannabinoids for symptom management? Well, a lot of patients have a lot of nausea, right? So cannabis can help decrease nausea and improve appetite. Depression. Someone takes a blow to the head and their whole brain is being disrupted. Well, there's going to be anxiety and depression. Their lives have been changed. So cannabinoids can help decrease depression and improve mood. Anxiety. Can you imagine having a traumatic brain injury and not knowing what's going to happen? That could cause a lot of anxiety. So cannabinoids can help decrease the anxiety and improve mood. Sleep issues. So the sleep-wake cycle is completely disrupted with people that have traumatic brain injury. And so cannabinoids are a really great tool to help decrease insomnia, improve sleep, and improve the circadian rhythm. So what are the different types of cannabinoids that we see? Well, as nurses, we like whole plant. We're all about whole plant medicine, both THC and CBD. But basically what we've learned through our education and through science is that it's preferably CBD dominant cannabinoids due to how CBD interacts with all of the other brain neurotransmitter signaling systems. Trust me, we are big components of THC, but CBD is really, really important. And the other thing that we like to do is like to talk about terpenes. So looking at different cannabinoid profiles or chemobars that have beta caryophyllene and terpene in them. Those are really, really beneficial and can help patients mitigate symptoms of traumatic brain injury. So THC and CBD mimic our internal endogenous cannabinoids, which can prevent the release of cytokines, which are the pro-inflammatory that causes the increased damage to the brain, right? So during this post-traumatic brain injury time, our bodies can release a toxic molecule. It's called glutamate, and it's the exocytic, it's the on-off switch, the firing of the brain. So cannabinoids, THC and CBD, can decrease that glutamate, which is that toxic molecule that causes our brain to be overly excited. THC and CBD can aid in the release of the monocycline, which is a chemical that reduces swelling in the brain and any neurological impairment that may be occurring. And the most fascinating part, too, is that THC and CBD can reduce brain cell death. Really important. So, what are some other therapies to complement? Well, other therapies to complement cannabinoid therapeutics and traditional therapy is diet. We all know that diet plays a huge part in health and wellness. So, a diet that's high in fat, low in carbohydrate, low in sugar, with plenty of leafy greens, omega-3 oils, and fermented foods. So, diet is huge. Our enteric nervous system, which is from our mouth all the way to our butt, gut to butt, I like to say, connects to our central nervous system via the endocannabinoid system. So everything that we're putting in our body does affect our brain. There is a thing called nutritional psychiatry. We're also big components of natural nutritional supplements, healthy eating, whole foods. So nutritional supplements and antioxidants such as magnesium, vitamin D, curcumin, glutathione, and melatonin to restore circadian rhythm and sleep. We're also big components of other health and wellness activities, acupuncture, neurobiofeedback, meditation, so truly working with someone to help decrease symptoms, to help them get back to a higher quality of life. I'd like to give a big shout out right now to Nikki Lawley. She's a former pediatric nurse that has had a severe traumatic brain injury on the job. We have shared her story here multiple times. She has a couple of podcasts up here on the channel, and we just recently shared a PowerPoint presentation that she did. So truly, thank you all for joining us today on this special segment of The Green Nurse and your daily dose of wisdom for wellness. Health awareness theme in January, National Winter Sports Traumatic Brain Injury. Everyone be safe. And remember what it's truly about. It's about living your best life.